First person I'd like to call on is Tadhg Daly, and Tadhg is the Chief Executive of Nursing Homes Ireland. It's the representative organisations of voluntary and private nursing homes in Ireland.
Thanks, Enda, and I'm delighted to be here today. Thanks for the invitation to Suzanne and her colleagues. We were represented as an organisation on the advisory group, ably by my colleague Sinead Morrissey, so we're pleased to see the publication of the report today. When I got the email first, I read it and I said, yeah, 58 minutes, that's great. And then I read it again, it said 5 to 8 minutes. Now Enda is telling me I have 5 minutes, and those of you who know me know that I could never say something in 5 minutes. But literally, I'm going to whiz through the few bits that I have. We are, as I say, a significant stakeholder. You know, you look at the figures in relation to that is in the report today. You know, 34% of the population with dementia in nursing homes, and we have obviously some figures ourselves. Just a bit about NHI. I'm not going to labour it, but representing the private and voluntary sector, 21,202 beds, over 70% of the bed stock in the country. A little bit about ourselves in terms of our members' commitment. I think it's important to say as well to you, the slides are I think, being shared by the conference organisers, so I'm not going to labour too much on them. I think it's fair to acknowledge that there have been significant positive developments over the last couple of years. And it would be, I suppose, churlish of us not to acknowledge that while we're looking at, I suppose, the challenges that face us into the future. And I think it's fair to acknowledge that the nursing home sector, all of us, public, private and voluntary, have embraced those developments. Obviously, the Health Act 2007, the establishment of HIQA, the national quality standards, including dementia-specific standards, the care and welfare regulations, and obviously the nursing home support scheme. And I have a but in there, but I mean, I'm not going to labour it, but I suppose one of the issues of the but is the narrow definition of goods and services in the nursing home support scheme, and some of the exclusions. In terms of the National Dementia Strategy, obviously a welcome and long overdue development. And again, doing a small bit of research for it, I was reading the Action Plan for Dementia 1999. And I hope we won't be here, I think Eamon mentioned it earlier on, but I hope we won't be here another 12, 13 years talking about the next action plan for dementia. And I was struck by what Glenn had to say from the Australian example about a revolution. And one of the things that we constantly hear, those of you who attend conferences from time to time, that Ireland is fantastic on producing reports and great on looking at what the problems are, what the challenges are, but very poor in implementation. And I think that's a challenge for all of us. Collectively, I'm not pointing fingers at anybody. We're part of the solution as well as everybody else. We obviously broadly support the recommendations in today's report, and from our view, we would argue that we need to recognise the speciality that is dementia care and designate dementia as a national health priority. And what I have there is a continuum of care required, and I think it's about having the appropriate support for that person at the appropriate time. It's not home care versus nursing homes or acute care versus home care. It's about, you know, ensuring that we have a care pathway or a roadmap. And I think some of the presentation by Florence from the French example looked at that in terms of a pathway for people, so that at whatever given time in their condition as it progresses, that there needs to be the appropriate level of support. And clearly the nursing homes is a significant part of that provision. Again, just some statistics. You've been bombarded with stats earlier on today, but I suppose there's no reliable data in terms of dementia specific. Yes, our survey looked, and I think 1 in 5, about 20% of our members would provide dementia specific care. Now that may or may not be in a dementia specific unit. The report published today estimates that 63% of all long-stay residents have dementia, and the majority of those reside in the private and voluntary sector. Our survey in 2009-2010 suggested about 38%, and obviously the Department of Health and Children long-stay stats suggested about 41%. So clearly there is, again, a requirement to provide for future care provision, and that comes back to the continuum of care. The cost was raised a few moments ago in relation to the Norwegian model, for example, and the units of 6. But again, just the average cost of care. Negotiations with the private sector, no negotiations in the public. Again, narrow definition of the long-term residential care services. The report highlights the issue in relation to the absence of a cost of care model. I'm aware of 3 of our members nationally that have a dementia-specific rate, as it were, for provision of dementia-specific care. Unfortunately, that's not a system that's right across the system. And again, we're unsure of how that was established, the criteria behind it, and why 3 have, and in fact, many others that provide dementia-specific care don't have. And I think there is no recognition, unfortunately, currently, which may act as a disincentive to the private and voluntary sector to provide care for dementia-specific. And I note that the report recommends the development of incentives, not just in nursing home care, right across the board, I would suggest, but I think it also needs to be looked at from a nursing home perspective. Just in terms of, I suppose, the nursing home-specific issues, and again, I'm conscious of time and I'm whizzing through them, but again, the absence of data, I don't have to tell you something you already know. Early diagnosis, obviously we need an assessment of need so that we can plan services appropriately. We need, obviously, dementia-specific education and training. There is very poor access to secondary services, and I think that's more pronounced potentially in the private and voluntary sector. Occupational therapy, physiotherapy, psychogeriatricians, etc. In terms of planning for future care provision, I think we have an opportunity now to get it right. There is a significant population, or a significant number of our population already with dementia. Obviously, the figures early this morning looking at, up until 140,000 people. That's a significant number by any stretch of the imagination. So we need a whole range of services, and nursing homes being an integral part. So in terms of the residential care element from an NHI point of view, it's important that the strategy would look at what the policy is, and I just mentioned that a few moments ago from maybe Geraldine's point of view as the policy makers, the department, and obviously the HSE as well. Because it's important that my members, the private and voluntary sector, would be aware of what direction of travel we're going in so that they can plan appropriately. Many of our members, for example, prior to the commencement of HICWA, would have future-proofed their buildings in terms of design and dementia-specific design, for example. So I think we need to start that debate now so that people can be prepared and be ahead of the curve in some respects, because whether we like it or not, the private sector in particular will respond to the market in many respects. The model, the specialist care unit, with, again, our Norwegian colleague talking about 6. Florence just there talking about it being integrated. So do we have a policy that it's integrated or specialist care unit? At the moment, one of the standards in the HICWA standards is that it would be limited to units of 10. Is that the appropriate size? I'm not an expert, far from it, I can assure you, but I think it's important that we grasp that nettle and communicate what the policy is in terms of optimum number and obviously design. And again, I don't want to labour the money issue, but obviously financing of long-term care, the review of the fair deal is scheduled for the back end of this year, and we would argue strongly that there needs to be dementia-specific provision within any scheme of financing for long-term care. So yes, in conclusion, we would argue again that it needs to be made a national health policy. The National Dementia Strategy is obviously an important step. Nursing homes are an essential element of service provision. Currently, in terms of long stay, the majority provider, in excess of 70% currently and rising. And it is important that there is real and meaningful engagement with all the stakeholders, including ourselves. And as an organisation, we would pride ourselves on the fact that we work in collaboration with people. Do we argue? Absolutely. Do we fight? Absolutely. Do we put our point of view across very strongly? We'd like to think so, but it's important that we're part of the engagement, and to date that has been a successful partnership, and we look forward to continuing that to ensure that we as an organisation and our members can continue to play a significant part in the development of the strategy. So thank you very much.
Well done.